So first things first, this is moulage. Moulage is an old word for cosmetic wounds, fake wounds which we apply to train potential first aid providers in wound care so they can see what they're likely to encounter in the field. And when it comes down to it, any of us can be a first aid provider. We've all cut ourselves before, we've all slipped and fallen before, or our children have, or loved ones have, right? So it's not so unlikely that we will have to treat a wound. So moulage is a great training tool, and if you want to learn how to use it, make it, and save some money, we have some great methods. We'll put that on the end. With any wound, stopping the bleeding is your most important concern. If it's bleeding heavily, if you see any pulsating, if the limb is blood-soaked, if you see blood pooling beneath the victim, that's serious bleeding. That may require a tourniquet. And always control bleeding first, okay? The first aid measures we're going to show in this instructional are about basic wounds. Nothing where, you're half missing a limb, you have to apply a tourniquet or anything like that. At the most, something like this, which may even require stitches if this was a real wound. For anything more serious, you want something like a stop the bleed course, and we'll have some more videos on that in the future. There's three primary things we're going to be looking at in basic wound assessment. The edging. Is the edging clean? Are the edges of the wound clean? If they're very straight, we call that an incision. If the edges are irregular, we'll call that a laceration. And if the edges indicate that the skin has been torn away, this was torn and not cut, then we'll say it's an avulsion. And with an avulsion, you may have flaps. That will mean extra care. We got to get under those flaps to make sure it's cleaned in the field, and we won't try to close that in the field. And I'll mention guidelines for closing in a second. So think of an avulsion where you get your ring finger stuck in something and it gets caught and you pulls away and the skin is torn. That's an avulsion. They're a little bit more complicated in cleaning and care. Next, we'll be judging the size of the wound. That's the length, width, and depth. And lastly, we want to see if there's any other tissues involved. Can I see the subcutaneous fat layer, muscle, or any connective tissue? Once the bleeding is controlled and the wound is assessed, we can now begin our care. The next step will be cleaning the wound. And for anything large like this, we want to remove it with tweezers first and not just start rinsing it out and hitting it with water and maybe even guide it under any skin flaps, basically. Now, when we clean a wound, we want to irrigate it and we want to disinfect it. Irrigate it means with pressure. That pressure gets a lot more done with less. We can remove much more material with less water. So if possible, in any serious first aid kit, and especially any group first aid kit, if you were the first aid guy for the group, we want something that we can have a little pressure with, even a little bottle like this. Many people will be carrying plastic water bottles like this, and all you need to do is poke a little hole in the top with anything that you have, even a safety pin. You can squeeze the bottle and get plenty of irrigation. Now, this is sterile saline. It's great for a group first aid kit, but a smaller bottle of something like this, more flat, which contains the antiseptic, is also good. Or, for something small, you can even have wipes as long as you have some form of disinfectant. After rinsing will come disinfection, and we want to be careful with what we use here. Now, in wilderness first aid, in field conditions that are much less clean, right? We're not in front of a sink. We're going to be sweating, dirty, getting pollen on it. Who knows? Well, we may not have many changes of clothes or bandages. We may use a little bit more harsh antiseptics than we would around the house. But two things that you're looking for here, if you're hours or days away from emergency care, are 10% iodine solution or less. We don't want full strength iodine. It harms the wound edging and healing. We don't want straight alcohol, anything like that. What we want is 10% iodine solution and BZK, or benzalkonium, also known as Bactine. So some antiseptic cleansing liquids like this provide irrigation and disinfection. Now, if this happens around the house and you're not worried about cleanliness, you're by a sink, you have soap and water, right? And you have regular access to soap and water, just use soap and water. Rinse it out, irrigate it out in front of the sink. You can let that water run for quite a while until everything's out. And then use a mild soap, okay? And don't be too harsh. And that's gonna be how you clean a wound at home. Too concentrated of a disinfectant or too strong of a disinfectant can harm the edging of the wounds in the natural biome, which is kind of bad for long-term healing and scarring. But out here in a pinch to make sure it doesn't get infected, again, if we're far away from care in a non-sterile environment, this is what we use. Now, I really like to have a gauze pad in my wound cleaning kit. So as I spray, as I irrigate, I can wipe with this. I'm going to use a lot less water. I'm going to get it a lot more clean if we have something really dirty, really bloody like this. Nice and absorbent. So I'll make sure I'm not getting it all over my med kit or myself. If a little gets on the patient, it's okay. It's their blood. Hey, they're the ones that messed up, right? See, I'm being careful, gentle, and deliberate there. And again, don't be afraid to use the tweezers. And if you have to change pads, change pads. It's no longer absorbing or removing material, use a second pad. Take your time, get this nice and clean. So again, to remind you of the steps, once bleeding is controlled, the wound is cleaned and assessed, then we can dress and bandage the wound. Now, a little bit of terminology here. The dressing is what you put directly on the wound. The bandage is what secures it to the body. Preferably, we want a sterile dressing, something clean. Of course, if we just need to stop bleeding in an emergency, any piece of clothing or anything like that will do. With basic wound care like this, we want a sterile dressing. Now, there's many types of dressings you can use. I prefer a non-stick pad in my wound care kits in the outdoors, so I don't have to use a moist dressing or anything like that. And even if it does stick to the wound a little bit, I can rinse and rinse and rinse. It'll come off without harming the patient, leaving little bits of fabric that the gauze does in the wound, which makes final cleaning, stitching in a medical setting more difficult. And it doesn't hurt to have a waterproof dressing like this out here as well, because we might be hiking in the rain. You get a little cut, you still want to go swimming in the river, what have you. You can use this to protect the dressing and bandage that you put on. Of course, I want a nice roll of gauze like this to serve as the bandage. And a gauze like this can serve as the dressing and the bandage. So I can Z-fold this and tuck it up and make a pressure dressing with this, or I can just use it to secure the dressing to the wound. Now, I like a bit of waterproof tape to secure my bandages with, right? Once I have it all wrapped up, I want something like this, because even if it's not going to be raining or we're not swimming or anything like that, I teach wilderness first aid, so they may be hiking and sweating quite a bit. So this will help make the bandage much more secure, much more rugged. So first I'll apply my sterile dressing. So I can cover the entire thing, or if it's a kind of a larger wound like this, as it threatens more bleeding, if they have to continually use the arm, they have to hike out for miles like this, we may fold it up as thick as possible, but still cover the wound. And that way, when we wrap it down, it applies pressure to the wound, and it's a basic pressure dressing. Now look, when it's just you and the patient, it's okay, and it's preferred to ask them for help. So as I get my roll of gauze going, I say, hey, Sheila, why don't you go ahead and hold this down? And got it. Smooth exchange, good teamwork. Now I can leave a little extra like so. This is just a little tip. And when I begin to wrap around, see, I'll fold it over like that. And they say that helps lock the bandage down. Okay, that's just a little extra from me to you. Now, it always helps to figure 8 wrap. So I can just wrap around the limb like this, but it helps to figure 8 wrap. And here's how we figure 8 wrap. So I'll go around here. It helps with the pressure, like a pressure bandage. So I go down, around. Here's rescue. Up, around. Ooh, there we go. Okay. Down, up. Now, I don't want this to be too tight. I will get patient feedback, and I can test it by being able to force 2 fingers under the bandage. And now, if we need more pressure, if we're having difficulty with the bleeding, we can give ourselves a little twist there right over the side of the wound. And you'll see that really digs in there good. If the wound is long like this, we can put those twists all the way along the wound. Now, I don't have to use the whole roll, especially if I have tape. I can just tape this piece here down and apply even more pressure, especially with a little bit more serious wound like the one we are demonstrating with. Now, again, have the patient help. It's good for morale, and it's good for you. So I'm going to go tape across the bottom. Notice I didn't use just a little piece of tape here. I want it to hold well, but I don't want to go around the whole arm in case it swells. And that little camera bump, that's field filming, baby. I'll cut the baby part out. Oops, shit. Now I'll go across the middle. She can release. And then across the top. Again, they may be sweating, hiking, if we're bushwhacking. This can hit a branch or whatever when it pulled off, right? Pulling your arm through your backpack strap. We don't want it being pulled off. We want this on good as a field bandage, a working bandage, and a little bit of a pressure bandage. If we're dealing with the kind of wound we use for the simulation, we want this constant pressure to help keep the wound from re-bleeding. And if we did close it in the field, this will help keep it closed. Again, get patient feedback. Does it hurt? Can you jam a finger or two under? Of course, I won't do it right on the wound, right? And I can always check capillary refill, push on the nail bed, gets white, less than 3 seconds, gets color back again. We are good to go. So again, the steps are bleeding control is always first. After that, wound assessment, then we begin proper care. We'll know how much irrigation, what types of bandages and dressings we'll need. Then we clean the wound. Cleaning the wound, we preferably have irrigation. Rinsing is okay. And then we disinfect it with the proper disinfectants. For at home, we just use soap and water. For out here in the field, hours or days from care, we might add a disinfectant to make sure that this doesn't wind up infected in these dirty field conditions where we don't have regular showers and things like that. Again, you don't have to fold up the dressing. You don't have to leave this roll here. I can cut the bandage. Again, the bandage doesn't necessarily have to be sterile if your dressings are. I can cut that, use it for changing the dressing later. However, if we need pressure, if we have a bigger wound like we saw here, we can add pressure through these methods. And remember, quality wound care is all about preparation. I had materials to irrigate and disinfect the wound with. I had a quality non-stick dressing that can be removed days later in a medical setting and not cause harm to the patient. And of course, I wrapped with a little bit extra methods. I use that figure eight, I use that pressure. Those little mods, if you will, those little cheat codes, that's just going to lead to more positive patient outcomes. And of course, you get speedier healing and less chance of infection. Now, I mentioned closing wounds in the field. Now, those of you that are tempted to learn how to stitch, or you want to glue a wound together or butterfly a wound together, there's some standards for that in the field. We're not going to show you how to do it right now, but I want to give you the standards so you don't do it inappropriately. It can't be gapped open. It can be longer, but it can't be wider than 1/2 inch open, okay? It can't be caused by an animal bite. You have to be able to thoroughly irrigate and disinfect. Something like this, we need more than just soap and water, okay? We're closing it up. It's not going to be opened again. So we can't have any bad bacteria in there. It has to be clean. It has to be thoroughly disinfected. Again, that's why we don't close up an animal bite, including a human bite, in the field. And it can't involve an open joint space, right? If I can see the joint, or if I can see subcutaneous tissue like muscle, other tissues like that, I won't close that in the field because, again, it's too great of a risk of infection. And note to viewer, compression bandages like this can add a lot more pressure in the field if we're talking about much more severe bleeding. We'll do something on more extensive pressure bandages later, but having a compression bandage like this, like an ACE bandage we would normally wrap a knee or an elbow with, can really help wrap a dressing like this down tightly and treat more severe bleeding in the field. Just a reminder, if you didn't see our ankle care video when performing first aid in the field, always have your mise en place. Cooks know what that means. That means putting everything in its place. Get everything that you need for care all laid out next to the area that you're going to be using it, so everything happens smoothly. Don't want to be reaching in and out of our pack, getting blood on things, anything like that. And here are the wounds. So I always have extra in case I apply one, it folds over, doesn't go how I like. I have some extra. Now I'll trim these edges a little bit, try and get these folds out. And the fake blood will cover the rest. You can apply body makeup, but no needed with something clear like this. And now we'll apply the artificial blood, which is just Kool-Aid powder and corn syrup. Now the stain, so any clothing you're using for training, you want to make sure it's okay if it gets stained.
Ew.
Good natural run there.